In this video we will discuss about all the electrical modalities used in physical therapy. This is the second part of our course. In the previous video, we discussed about the definition and history of physiotherapy, career opportunities and medical terminologies. Let's start the video. Electrotherapy is a method of medical treatment which uses electric current to the affected areas. It is mostly used in physiotherapy to treat a variety of conditions ranging from muscle pain to arthritis. A modality is the use of a therapeutic agent. This is the application of a specific item to achieve a treatment effect. Heat. The most effective heat therapy products are those that can maintain their heat at the proper temperature for an extended period of time. The appropriate temperature is warm. The heat sources should not be so hot that they causes any burning sensation to the skin. The desired effect for the heat is to penetrate deep into the muscles. Types of heat therapy. Dry heat, such as electric heating pads and saunas, draw out moisture from the body and may leave the skin dehydrated. However, some people feel that dry heat is the easiest to apply and feels the best. Moist heat, such as hot baths, steam towels, or moist heating packs, can aid in the heat penetration into the muscles, and some people feel that moist heat provides better pain relief. Some common options include hot water bottle, tends to stay warm for 20 to 30 minutes. Electric heating pad, maintains a constant level of heat as long as it is plugged in. Heated gel packs, may be microwaved, or sometimes heated in water, and tend to stay warm for about 30 minutes. Certain types of gel packs provide moist heat, which some people prefer. Heat wraps, wraps around the lower back and waist and may be worn against the skin under clothing, providing convenience and several hours of low level of heat application. Hot bath, hot tub, sauna, steam bath, tend to stimulate general feelings of comfort and relaxation that may help reduce muscle spasm and pain. A whirlpool jet, directed at the lower back, may provide the added benefit of a light massage. Primary physiological effects of heat include vasodilation and increased blood flow, increased metabolic rate, relaxation of muscle spasm, pain relief via the gait control mechanism, reduced ischemia, and increased elasticity of connective tissue. Heat should not be used in certain conditions. For example, if there is swelling or bruising, heat application is also not suitable in the following cases: dermatitis, deep vein thrombosis, diabetes, peripheral vascular disease, open wounds, and severe cognitive impairment. Next one is cryotherapy. Cryotherapy includes ice massage, cold hydrocollator packs, cold whirlpool, cold spray, contrast baths, ice immersion, cold compression, and cryokinetics. Primary physiological effects of cold therapy includes vasoconstriction and decreased blood flow within first 15 to 20 minutes. Decreased metabolic rate, pain relief, with decreased muscle spasm via gait control mechanism, decreased nerve conduction velocity, and restriction of local blood flow, reduces the potential for edema to develop. Contraindications or precautions of cold therapy is deep vein thrombosis, hemorrhagic conditions, chronic wound, impaired cognition or communication, cold hypersensitivity, impaired circulation, tuberculosis, damaged or at-risk skin, cardiac failure, hypertension, impaired sensation and infection. Hydrotherapy, or water therapy, is a complementary therapy that uses water for health purposes. Hydrotherapy is often used for temporary skin-related issues, such as burns and septic ulcers, or for chronic health conditions, such as arthritis and fibromyalgia. Hydrotherapy may offer a range of benefits, including reducing pain. Hydrotherapy using warm water had a significant pain-relieving effect in people with chronic diseases of the musculoskeletal system and connective tissues. The warm water may ease the signals for pain, relax the muscles, and increase blood flow, reducing pain in the area. Benefits of hydrotherapy: improving mental health. Studies shows that water-based activities improve mental health in some people. For example, people with fibromyalgia may find aquatic exercises reduces anxiety and depression. Additionally, many may find that swimming improves their mood and helps release tension through exercise. The second benefit is, it improves arthritis symptoms. For example, one study found that people with osteoarthritis in the knee had improved markers of pain and knee function after 8 weeks of aquatic exercise. The next one is relaxation. Many forms of hydrotherapy also aid relaxation, both physically and mentally. Warm water may help ease tension in the muscles, while promoting a relaxed state of mind. Recovering from workouts, athletes sometimes use various forms of hydrotherapy, in which they alternate between warm and cold water. Many feel that this form of contrast hydrotherapy helps them recover from hard workouts and avoid delayed onset muscle soreness. Pregnancy and hydrotherapy. Hydrotherapy may help with the general aches and pains that pregnancy can cause. Types of hydrotherapy. Aquatic exercises is a low-impact form of physical activity, which are typically performed in a pool using specialized equipment. It allows people to work the muscles and raise the heart rate, without putting much stress on the joints. These exercise routines are suitable for people with arthritis or fibromyalgia, and for older people who may be at higher risk of falling, or just find working out easier in the low-impact environment. Warm water baths. Soaking in a warm water bath is a form of hydrotherapy. The person may also add salts and minerals, essential oils, or other ingredients to enhance the bath. Warm water baths promotes relaxation. Sitz bath. A sitz bath is a shallow bath, using either warm or cold water. Practitioners may recommend sitz baths for relief from issues such as cramps or hemorrhoids. Wraps and compresses. Wraps and compresses using hot, warm or cold water are also a form of hydrotherapy. These may provide targeted relief from mild symptoms and support treatment. Water circuit therapy, or contrast hydrotherapy. It involves going through a few different forms of hydrotherapy one after the other, generally alternating between warm and cold water, to promote circulation and help ease symptoms. Whirlpool bath. The whirlpool is a container filled with water, with an apparatus that allows the water to circulate. This has a massaging effect, and soothes pain. The temperature of the water in the whirlpool can be warm or cold, depending on the desired goal. Infrared therapy. Infrared light treatment is considered medically necessary, as a heat modality in physical therapy. Infrared radiations with wavelength of 750 to 400,000 nanometers. Infrared has two types according to its wavelength. Short infrared, wavelength is 750 to 1500 nanometers, long infrared, wavelength above 1500 nanometers. Therapeutic effects of infrared are pain relief, reduce muscle spasm, minimize the joint stiffness, reduce inflammation, and promotes healing. Maximum penetration is 3 cm. It may vary from 0.1 to few cm. Indications of infrared are low back pain, osteoarthritis, rheumatoid arthritis, sprains, strains, capsulitis, tendinitis, frozen shoulder, traumatic arthritis, and ankylosing spondylitis. Contraindications of infrared are malignant area, impaired sensation, anesthetic area, advanced cardiac disease, eczema, dermatitis, impaired circulation, non-inflammatory edema, hemorrhagic condition, and varicose vein. TENS. TENS stands for Transcutaneous Electrical Nerve Stimulation. A TENS unit consists of a battery-powered device that delivers electrical impulses through electrodes placed on the surface of skin. Transcutaneous electrical nerve stimulation is a therapy that uses low-voltage electrical current to provide pain relief. Electrodes are applied to the affected area. The machine sends signals through wires to the electrodes. A tingling sensation is often felt in the underlying skin and muscles. The electricity disrupts the pain signal from the nerve to the brain. The electrodes are placed at or near nerves, where the pain is located or at trigger points. TENS therapy has been used to relieve both the chronic and acute conditions. Some of the most common conditions for which TENS has been used include osteoarthritis, tendinitis, bursitis, labor pain, low back pain, chronic pelvic pain, diabetic neuropathy, and peripheral artery disease. It has three mode settings: normal, burst, and modulation. Modulation. This is useful for both acute and chronic pain relief. Burst mode is useful in chronic pain relief. Pulse rate is the number of electrical pulses you will feel in 1 second. Frequency is measured in hertz. The following settings are recommended. Acute pain is usually most effective between 80 and 120 Hz. Chronic pain can also benefit from lower settings, 2 to 10 Hz, that stimulates an endorphin release. A setting between 35 and 50 Hz is commonly used to stimulate muscles for strengthening or even relaxation. Pulse width. These are the on periods of the current. The following setting is recommended: 175 to 200 microsecond. Time duration. For acute pain, 20 to 60 minutes, up to 4 times daily. For chronic pain, 20 to 30 minutes, up to 5 times weekly. Contraindications or precautions of TENS are deep venous thrombosis or thrombophlebitis, hemorrhagic conditions, pregnancy, impaired cognition or communication, cardiac failure, damaged or at-risk skin, infection or tuberculosis, malignancy, impaired sensation, active epiphysis, skin disease, impaired circulation and skin irritation. Electrical muscle stimulation (EMS), also known as neuromuscular electrical stimulation or electromyostimulation. Electrical muscle stimulation can be used as a training, therapeutic, or cosmetic tool. The use of electrotherapy has been acknowledged by the American Physical Therapy to provide the following benefits: managing and reducing pain, helping with blood flow and improving circulation, facilitating the repair of muscle and other body tissues, improving the effectiveness in delivering prescription drugs, which is called as electromotive drug administration. Indications of EMS include relaxing muscle spasm, preventing or slowing tissue atrophy due to disuse, increasing blood circulation, re-educating muscles, maintaining or increasing range of motion. Parameter settings of EMS. These are various parameters of EMS that can be adjusted according to our goal of treatment. Different waveforms used in stimulation therapy. Russian current. The Russian current waveform is a type of electrical stimulation that delivers medium frequency current in alternating pulses or bursts of energy. This type of stimulation generates a motor response, which can be used to strengthen muscles and muscular re-education. Russian current can also be used to stimulate an analgesic effect in the muscles, making it effective in reducing pain as well as increasing muscular strength. Interferential current, it is used to address chronic, post-surgical and post-trauma acute pain in patients. The IFC waveform offers deep tissue penetration over a larger volume of tissue, making it a great choice when treating conditions like back pain, arthritis and shingles, etc. Pre-modulated current, a bipolar technique in which the two frequencies are mixed inside the machine, prior to the tissue delivery. Pre-modulated current may be used for pain control, or edema reduction. Biphasic current, biphasic, refers to two phases, or pulses, of two different intensities, alternating with each other during treatment. Biphasic current EMS can be used to strengthen muscles, re-educate muscles, increase circulation and decrease swelling. High voltage electrical stimulation can be used to decrease pain, edema, and facilitate in wound healing. Because of its ability to aid in circulation, high voltage can be used to great effect in healing wounds, in patients with circulatory issues such as diabetes. Additionally, this waveform can be used to relieve muscle spasm. Microcurrent, it uses electrical energy that is less than 1 mA to stimulate acupuncture points, and provide balance between the peripheral and somatic nervous systems. Indications of EMS include neck pain, back pain, arthritis-related pain, radiculopathy, sciatica, sprains and strains, intercostal neuralgia, fibromyalgia, peripheral neuropathy, vertigo, Bell's palsy, and scars. Contraindications or precautions of EMS, deep venous thrombosis or thrombophlebitis, hemorrhagic conditions, pregnancy, impaired cognition or communication, damaged or at-risk skin, infection or tuberculosis, malignancy, electronic device, impaired sensation, active epiphysis, skin disease, and impaired circulation. Game Ready, it integrates cryotherapy, thermotherapy, rapid contrast therapy, and intermittent pneumatic compression therapy into one device. Laser therapy, laser stands for light amplification by stimulated emission of radiation. LLRT is a non-invasive light source treatment that generates a single wavelength of light. It emits no heat, sound, or vibration. Wavelengths between 660 nanometers and 905 nanometers have the ability to penetrate skin and soft, hard tissues. This light have a good effect on pain, inflammation and tissue repair. Indications of laser therapy are osteoarthritis of the knee, hip and ankle, rheumatoid arthritis, temporomandibular disorders, shoulder impingement syndromes, hip or shoulder bursitis, low back disc degeneration, disc herniation, sciatica, neuropathic pain, tendinitis, tennis elbow, plantar fasciitis, reduction of volume and pain in lymphedema. Contraindications of laser therapy are cancer, pregnancy, and epileptics. Diathermy. Diathermy is a therapeutic treatment most commonly prescribed for muscle and joint conditions. It uses a high-frequency electric current to stimulate heat generation within body tissues. The heat can help with various processes including increasing blood flow, relieving pain, and improving the mobility of tissues as they heal. Types of diathermy. There are three main types of diathermy: shortwave diathermy, microwave diathermy, and ultrasound. Shortwave diathermy, it uses electromagnetic radio waves to deliver heat down to 3 to 5 centimeters below the skin, without overheating the skin and subcutaneous tissue. Shortwave diathermy used in physiotherapy utilize the following frequencies. 27.12 MHz, with wavelength 11 meters. 13.56 MHz with wavelength 22 meters. 40.68 MHz, with wavelength 7.5 meters. Indications of shortwave diathermy, disorder of musculoskeletal system including sprain, strain, capsular lesion like frozen shoulder, and degenerative joint disease like osteoarthritis, chronic inflammatory conditions including tendinitis, bursitis, and tenosynovitis. Contraindication of shortwave diathermy includes hemorrhage, venous thrombosis of phlebitis, arterial disease, pregnancy, metal in the tissues, disturbed skin sensation and tumors. Microwave diathermy, it uses microwaves to generate heat in the body. It can be used to evenly warm deep tissues, without heating the skin. Since it can't penetrate deep muscles, it is best suited for areas that are closer to the skin, such as the shoulders. The two frequencies designated for microwave diathermy are 915 MHz and 2456 MHz, with the former being the most commonly used. Indication of microwave diathermy, musculoskeletal disorders like sprain, strain, capsular lesion, degenerative joint disease, joint stiffness and torticollis. Chronic inflammatory condition like tendinitis, bursitis and tenosynovitis. Contraindications of microwave diathermy are anesthetic area, malignant tissue, severe edema, metallic implant, cardiac pacemaker, acute inflammation, infected open wound, impaired thermal sensation, recent radiotherapy, blood pressure abnormality and tuberculosis. Benefits of diathermy. The diathermy machine does not apply heat directly to the body. Instead, the waves generated by the machine allow the body to generate heat from within the targeted tissue. Diathermy is used to treat the following conditions: arthritis, back pain, fibromyalgia, muscle spasms, myositis, neuralgia, sprains and strains, tenosynovitis, tendinitis and bursitis. Ultrasound. An ultrasound uses sound waves for treatment. The use of ultrasound on muscles causes them to warm, promoting tissues relaxation, thus decreasing tightness and spasm. The warming effect also causes vasodilation, similar to heat. This can facilitate healing. Ultrasound is ideal for deep muscle relaxation and pain relief. Frequency. Frequency is determined by the depth of the tissue that needs to be treated. A setting of 1 MHz is used for 5 cm of depth, while a setting of 3 MHz is used for 1 to 2 cm of depth. Intensity of ultrasound. When heat is the desired effect, then an intensity of 1.5 to 2.0 watt per square centimeter will used. The intensity is increased if no sensation of warmth is felt within 2 to 3 minutes, but decreased immediately if there are any complaints. Non-thermal options will use intensity of 0.5 to 1 watt per square centimeter. It is important to never keep the ultrasound in one place, always keep it moving, using ultrasound gel to form a barrier between the skin and the ultrasound. The setting for ultrasound is usually from 5 to 10 minutes. Contraindication of ultrasound. Ultrasound should never be used over known tumors, pregnancy, artificial joints, a pacemaker, on the eyes or reproductive organs, epiphyseal plates, fractures and breast implants. That is all about the physiotherapy modalities. Hope so it will be beneficial for you. Watch next part of course about the therapeutic exercises.